Dr. Linda Park here. Today I'm going to talk about breathing. I've talked so much about breathing and the importance when we're sleeping, when we're walking around, when we're listening in class, when we're watching TV, and all these things. Our mouths are supposed to be closed. The thing I want to talk about right now is maybe you remember me saying that nasal breathing is diaphragmatic breathing. And diaphragmatic breathing is not the upper chest breathing. Remember what I said about that. Upper chest breathing is fight or flight and sympathetic and ready for action. And you can't digest your food if you're living in sympathetic mode. So how do we change from sympathetic mode to rest and relax mode? That's parasympathetic. So something that would be helpful, and I think I've talked about this in the past, where we talk about breathing in slowly through your nose for 3 seconds, exhaling for 4 seconds through your nose, in through your nose and out through your nose. That's a technique called box breathing. In through your nose, out through your nose, in through your nose, out through your nose. What does that do? That changes the whole brain function from that sympathetic mode to parasympathetic mode. So then your body gets ready for rest and digest, rest and relax. So if you can form that habit before you sit down to eat a meal, then what you'll find is you'll actually be able to digest better. Maybe you'll have less of a stomach ache when you're done eating. They've found in different populations and working environments, and nursing is a key environment where this is the case. They're busy running around helping people, many stressful situations. A lot of them have more GI issues because they're eating on the run. How many of us eat in the car or eat while we're talking to other people, eat while we're watching TV and doing all these other things where we're distracted from the primary function of just eating our food? And breathing is a big part of that. So starting with the exercise of taking a deep, slow breath in, deep, slow breath out, and pause before you eat. That actually changes things. It's the same thing with offering up a prayer to the Lord and thanking Him for our food, a prayer of gratitude, where we pause and our digestion actually activates so we can use our food to the fullest extent that it was meant to be. Another part of the eating process that's important is chewing our food. We should be chewing our food a minimum of 20 times before we swallow it. People may say, 20 times? Are you kidding me? Can't do that with a peanut butter and jelly sandwich. Can't do that with applesauce. But you can do it with meat. You can do it with carrots that are uncooked. You can do it with maybe apples. Some other foods that are harder. Those are things that promote jaw development and stimulate jaw muscles. And that's important for correct arch formation. It's also important for tongue posture. The other thing that it does is stimulates digestion and turns on the digestive process. And it's important to do that because if we, as I said before, are in that fight or flight, we're not thinking about chewing our food and taking time to eat. We're just thinking about getting it done so we can take care of whatever we have to get to. So it's really important for us to do that, to slow the process down in our busy life where we can actually absorb our food properly. And if you're not chewing it enough times, then your stomach has to do a lot more work once the food gets there. And then the nutrients and the minerals don't get to do their work because they don't get to go to the muscles to provide support that we need. So chewing 20 times is chewing hard foods, and not necessarily rock hard foods like rock candy or super hard nuts all the time, but meats that have the vitamin A, vitamin D, vitamin K, all the important nutrients for our bodies, building blocks, good healthy fats. And in this modern environment, We have so much of the quick foods, and even at schools there's pop, and they're working on getting some of those vending machines out of the schools that promote sugar, and even Gatorade, which is thought to be some miracle for kids in that are athletes to nourish their bodies, but it still has sugar in it, and it's artificial color, all those things. The reward system at school, it's fraught with candy. If a child is given a reward for good behavior of a quarter, and he goes to the little candy machines, and he gets to choose between M&Ms or Skittles or Sweet Tarts, and all those things are candy that they load up in their body so that they can reduce their immune function and have less calcium in their bodies. So those are all things that modern living has produced for us and has caused many of the problems that we see today in children in growth and development. So these things that I'm talking about are really just ancient practices, things that were done hundreds of years ago, probably thousands of years ago, that have promoted correct jaw development. And as we see, as I said, 90% of the population needs braces. Why is that? Modern living. So some of the sources for my information are, there's a book called GOPex, Good Oral Posture Exercises. And that's the chewing your food 20 times. That's the sitting up straight. That's the take a pause and take a deep breath and activate your parasympathetic nervous system. All those things help to create healthy digestion, healthy kids, growing faces, and beautiful smiles. Another book that has been helpful, and actually has just been released, but the whole topic is part of the premise of my practice, and that is nasal breathing and tongue on the roof of the mouth. That was promoted by Professor John Mew, who is an orthodontist, and his son, Mike Mew, an orthodontist from England. And it really started a rage of a movement in England and in also the United States about the importance of airway, the importance of proper tongue posture. You've heard of mewing. If you just look at that on YouTube, mewing is an exercise that develops the jaw structures to a beautiful square jaw. And it's just basically having the tongue on the roof of the mouth. God meant our tongues to be expanders and to promote a nice, wide, healthy jaw. But if you sit there and think about, where's my tongue right now as I'm sitting here watching this video? Is it up on the roof of the mouth? Or is it down on the floor of the mouth? If it's down on the floor of the mouth, it's not supporting the teeth. It's not supporting that proper arch development and the nice wide jaws. The other part that's important about that is correct swallow. There are many patients that have open bites. And when you swallow, we swallow 3,000 times in a day. And we do it without even thinking about it most of the time. And if your tongue is not up on the roof of your mouth, which that type of swallow is developed, proper swallow, is developed in the habit of nursing when you're an infant. And if it isn't trained that way, that's where jaws shrinking begins. Hope you found this video helpful about meals and about breathing and all the things we need to be thinking about on a daily basis. If you did, offer up any questions you might have. I'd be more than happy to answer them. And like and subscribe for more great content.